The human body is designed to efficiently process fluids, filtering out waste through the kidneys and excreting it via the bladder. While the body can tolerate holding urine for a short period, consistently delaying urination can have negative effects on overall health. Many people hold their pee due to work commitments, lack of accessible restrooms, or simply ignoring the urge. However, this seemingly harmless habit can lead to various complications, ranging from mild discomfort to severe medical conditions. When urine accumulates in the bladder, it stretches to accommodate the increasing volume. While the bladder is highly elastic, frequent overstretching can weaken its muscles over time. This can lead to reduced bladder control, making it difficult to completely empty the bladder when urinating. The weakening of the bladder muscles can also contribute to urinary retention, a condition where urine remains in the bladder even after attempting to empty it, increasing the risk of infections and other complications. One of the most immediate and common consequences of holding in urine is discomfort and pain. As the bladder fills beyond its comfortable capacity, the increased pressure can cause cramping and pain in the lower abdomen. This discomfort can radiate to the lower back and pelvic region. In severe cases, individuals may experience sharp pain or spasms due to excessive bladder distension, affecting daily activities and overall well-being. Urinary tract infections, UTIs, are another significant risk associated with holding urine for extended periods. Bacteria that enter the urinary tract are typically flushed out through urination. When urine is retained for too long, bacteria have more time to multiply in the bladder, increasing the likelihood of infection. Symptoms of a UTI include burning sensations during urination, frequent urges to urinate, cloudy or foul-smelling urine, and lower abdominal pain. Left untreated, a UTI can progress to a kidney infection, which can cause fever, chills, back pain, and serious health complications. Kidney health can also be compromised by habitual urine retention. The kidneys continuously filter waste from the eye, bloodstream, and prolonged urine retention can cause urine to back up into the kidneys, leading to hydronephrosis. This condition involves swelling of the kidneys due to urine buildup, potentially causing long-term damage. Chronic cases can lead to kidney infections and impair kidney function, making waste elimination less efficient and increasing the risk of kidney disease. Bladder infections are another possible consequence of holding in urine. Similar to UTIs, bladder infections occur when bacteria proliferate in stagnant urine. The symptoms often mirror those of a UTI, including pain during urination, frequent urges to urinate, and pelvic discomfort. In severe cases, untreated bladder infections can spread to the kidneys, leading to more serious medical conditions that require immediate intervention. Frequent urine retention can also contribute to incontinence, a condition where a person loses control over their bladder. Over time, overstretching the bladder can weaken the pelvic floor muscles, making it difficult to control the release of urine. Stress incontinence, where urine leaks occur due to pressure on the bladder from coughing, sneezing, or exercising, is a common outcome. This condition is particularly concerning for older adults and women who have gone through pregnancy and childbirth, as their pelvic muscles are already at risk of weakening. People who frequently hold their pee may also experience an increased risk of bladder stones. These are hard mineral deposits that form when urine becomes concentrated, allowing minerals to crystallize and form stones. Holding urine for long periods can contribute to the formation of these stones, leading to pain, difficulty urinating, and potential blockages that may require medical intervention or surgical removal. In severe cases, prolonged urine retention can lead to urinary retention syndrome, a condition where the bladder becomes unable to release urine effectively. This can result in the need for catheterization to manually drain the bladder. Chronic urinary retention can also increase the likelihood of bladder infections and kidney damage over time. Another potential risk of holding urine, too, often is an increased chance of bladder rupture. While rare, excessive bladder distension can cause the bladder wall to weaken and rupture, leading to a medical emergency. A ruptured bladder can result in urine leaking into the abdominal cavity, causing severe pain, infection, and requiring immediate surgical intervention. Additionally, the nervous system plays a role in regulating bladder function. Consistently delaying urination can interfere with nerve signals that communicate bladder fullness to the brain. Over time, this can lead to desensitization, making it harder to recognize the urge to urinate until the bladder is excessively full. This can contribute to irregular urination patterns and potential complications with bladder function. Pregnant women should be especially cautious about holding in urine, as they are already at a higher risk of developing urinary tract infections and bladder-related Issues due to hormonal changes and increased pressure from the growing uterus. Holding urine for long periods can further increase the likelihood of infections, which can lead to complications such as preterm labor or low birth weight in babies. For individuals with pre-existing medical conditions such as diabetes, neurological disorders, or prostate issues, holding urine can worsen their condition. Diabetes, for example, can cause nerve damage that affects bladder control, making it essential for individuals to maintain healthy urination habits. Those with enlarged prostates may already experience difficulty in emptying their bladders, and delaying urination can exacerbate their symptoms.